Welcome to the video, and we are going to be exploring is how can you find a designated prescribing practitioner in a city that I love, and that is Newcastle. As always, folks, thank you for all your support. Do subscribe, like, and share, and let's get into this video. So in this video, we are looking at how you can find a designated prescribing practitioner in Newcastle. Now, some of you will know this terminology, designated prescribing practitioner, as a DPP. Some of you might refer to it as a DMP. And if you're a nurse, you might refer to it as a practice assessor. But these terms are interchangeable, synonymous you can say. So when I do use this terminology, don't get confused. But before we start to look at how you can find one, I want to really break this video down into small pieces. First of all, why do you need, or what is a DPP? Why is it relevant? Why is it important? Well, we have to go back and have a look at and mention a course, and that is the independent prescribing course. Again, let's get some terminology out of the way. It's also known as the V300 course, and some of you may also know it as the non-medical prescribing course. But this course essentially gives access to pharmacists, nurses, physios, paramedics, podiatrists, dietitians, optometrists, radiographers, and others access to be able to prescribe. So that's the key thing. If you complete this qualification or you gain this qualification, folks, you're going to be able to prescribe within your area of expertise. Now, let me make that clear. You can prescribe within your area of expertise, but of course, you can expand that expertise within your regulatory framework, legislation, but you can always expand depending on your profession. So, this course gives you access to prescribing rights. If you meet the requirements, or by law, you can do the course itself. And in order to do the course, keep three things in mind. Number one, you need to find a university that is accredited by your regulatory body. So pharmacists, visit the GPHC website, nurses, and NMC. And if you're an adult healthcare professional, you can visit your regulatory website to see which universities actually offer this course and are accredited to deliver this course. Then what you need to do is choose a scope of practice. Now, how do you choose a scope of practice? What is a scope of practice? Essentially, a scope of practice is an area that you are already competent in. So that means that you have the knowledge, skills, and you display the right behaviors to diagnose, treat, manage this particular condition, and then you can gain your prescribing qualification in that condition itself. Let me make it clear for you. Imagine you're a nurse and you're working in a hospital and you're seeing intensive care patients. You've been doing it for, let's say, a couple of years. You're actively seeing patients, you're taking thorough histories, you're diagnosing, you're treating, but you have to refer to a prescriber, for example, a doctor, to raise a prescription. You're actively communicating with the doctor, making recommendations, making changes, but the doctor ultimately prescribes. Then that would be your scope of practice. If you're a community pharmacist working in a community, you're seeing patients, for example, in ear condition, nose condition, throat conditions. You're recommending perhaps medication over the counter. You're counseling patient. You're recommending them when they need to see a GP or an appropriate prescriber. You're giving them alarm features of what to look out for. Then absolutely, you are in the right position to choose that as a scope of practice. Again, very important. You're in the right position to choose that as a scope of practice. Let's do another scenario where you're a professional and you have a desire to gain your prescribing qualification in diabetes. Ask yourself, do you know the cause of diabetes? Do you know the pathology? Do you know the signs and symptoms? Do you know when to refer patients? Do you know how to treat patients? So you've got the knowledge. Do you have the skills? Have you spent time and been mentored by a doctor or another healthcare professional? Are you actively communicating the diagnosis of the treatment options with the relevant prescriber? Even though you're not prescribing, but do you have the skills? Do you have the knowledge, and do you have the right behaviors where you're taking a holistic approach? You're considering not only the medication, not only the medical aspect of the actual disease itself, but you're thinking of the patient's values, their social circumstances, then you can prescribe in that condition itself or use that as a scope of practice. Why I'm saying this is because we have a lot of individuals who get in touch with us at MEDLRN who say, I want a DPP, or I want this designated prescribing practitioner, I want to develop my skills, and I would like to learn diabetes. I would like to learn hypertension. And then we ask them, is that really your scope of practice? Do you have the experience? So again, very important to keep that in mind, that you've got to choose your scope. Once you've found a university, you're clear with your scope of practice, then you've got to find a designated prescribing practitioner, a DPP, also known as a practice assessor. And if you're a nurse, you'll also need a practice supervisor. We'll touch on that in further videos. So what is a DPP? This is an individual who's been qualified and actively prescribing for 3 years, understands the DPP competency. So you can't just act as one, you have to be competent to act as one. Again, you have to have the knowledge, skills and behaviors because you're actively supervising someone. So you need to make sure that this individual has the skills, has the knowledge. Then they can essentially act as your DPP. They're going to be playing a very important role in guiding you on the course itself, helping you pass the course, examining you, because the university will require them to essentially do OSCEs with you, allow you to supervise, perhaps allow you to do different skills. For example, take blood pressures, measure someone's pulse, respiratory rate, documentation, undertake a physical examination. So they're playing a huge role in making sure that you're safe and you're competent. So it needs to be the right individual. Now that you understand that this role is very diverse, it's challenging, you probably also understand that it's difficult to find one, because we know there's already a shortage of doctors and pharmacists and nurses. And then now you have to find someone who's been qualified for 3 years within your scope, actively prescribing and understands the requirements. Can get quite challenging. Some of the reasons why it's difficult to find one is because there's a shortage of these professionals. There's not really much of a financial reward. And again, that might be controversial, a separate conversation. And also, they don't know what's required. You may find someone, but doesn't really understand what's required. So how do you find one? How do you find one in Newcastle? Let's talk about specifically Newcastle, where there's the Yorkshire and Humber training hubs. Go onto their website. They've got a directory that can help you. Get in touch with them first. That might be useful for you. If that doesn't help, look at local NHS trusts and hospitals. Get in touch with them. Build relationships. If that's not used for you, think about essentially your locality. Do you know any prescribers within your locality? So that's touching into your own database. If that doesn't work as well, when you've got in contact with them, you've made your introductions and you still have had no luck, then essentially what I would recommend you should do is visit LinkedIn Sales Navigator or LinkedIn and start to develop your portfolio, develop your connections. It's not that difficult, but you're going to have to be proactive. That works quite nicely as well. Visit LinkedIn, send a connection request. Don't keep it generic. Introduce yourself. First, understand what's required yourself. That's what I would recommend. 3 things. Think about the local PCNs. Think about the Yorkshire Humber training hubs. Also, we know that there's treat and teach clinics set up in Newcastle. Visit Google, have a look at them. That should also help you as well. And if you tried all of this and it doesn't help, you can absolutely get in touch with us at MEDLRN. We can not only support you to find the right supervisor, the supervisor that's motivated to support you, but also a supervisor that will take you on a journey from the start to finish and after you qualify, and also support you on developing your CPD. Now, one last thing I want to mention, that the prescribing course is not designed to teach you clinical skills. That's not what the learning outcomes are. It's designed to assess, test, and make sure that you're competent already within your scope of practice. The prescribing course is a 6-month course. You have to do 90 hours of supervision with a DPP. So that means that you're going to be watching the DPP. They're going to get you to do activities. They're going to test you, ask you questions, reflections, and reflecting on your practice. Some universities also require an examination. That can be written, oral, for example, presentation, but also pharmacology and calculations. So keep that in mind, there's quite a bit involved. In addition to this, remember folks, that you have to be proactive. In order to get the best out of the course, be proactive. Have a clear conversation with your DPP in terms of expectations. Make sure you know what's required. Study in advance, prepare yourself in advance. There's various textbooks that I'll make another video on that you can get hold of on non-medical prescribing. And if you study small amounts every day, I can promise you you'll get the best out of your course itself. I hope you found this video useful. Thank you for watching. Subscribe, like and share. And if you're struggling to find a DPP, get in touch with us at MEDLRN. We are more than happy to support you, more than happy to organize it for you and get you on the right steps. Thank you for watching. Welcome to the video, and we are going to be exploring is how can you find a designated prescribing practitioner in a city that I love, and that is Newcastle. As always, folks, thank you for all your support. Do subscribe, like and share, and let's get into this video.